Hey, so I'm in my office today and I'm doing a very unplanned, very impromptu, unscripted video for you. This video is not for everyone. I would encourage you, if you have anxiety about recurrence, this could be triggering for you. It also could be really helpful for you, so you'll know as you listen and watch what I'm saying, whether or not this is a helpful video for you. I am only making this because I have never seen a video like this. And I myself benefit from hearing about the experiences of others. I know this is not always true of other people, however, so this whole conversation could be really, really difficult. Feel free to turn it off at any time and check back in with me a couple weeks from now when I'll know a little bit more about my destiny. My name is Kathleen Moss, and I am kind of documenting my whole experience of breast cancer, early stage, and mastectomy here on YouTube. I've got about 100 videos about that story, and I am just loving being in community with viewers out there who are needing this kind of content. Today's video is about the process that I've gone through over the last month with what seems to be more likely to be a possible small recurrence. To me, I've had lots of scares over the last year or so. I've had a little over 2 years since my first mastectomy, and my main diagnosis was DCIS, and I had also a very small amount of lobular cancer. And so I've been learning a lot about lobular cancer because it's a lot more scary than DCIS, but the main thing I had in my breast was DCIS. I had a lot of it. And I was told by my oncologist that DCIS comes back in the skin, and it's really obvious. It's little things showing up on the skin, on the surface of the skin. So that was really reassuring to me at first. I thought, well, if I see something, I'll know. And she's been really great at responding to every little skin thing that has come up, and there's been about 5 of them, I would say. Usually it seems like a really, really hard centered zit, like it's a pimple that has a really hard core, and it resolves really quickly and easily, and I'm able to get into my oncologist really quickly and easily. And I've only had skin scares so far, and I've only had, I think, 2 ultrasounds in response to those skin scares. The ugliest one was in my armpit. It was really red and inflamed and larger than usual, and that was about 6 months ago. And so I've kind of been like, the boy who cried wolf to myself in a lot of ways, in that I've had a lot of these little scary things pop up over the last couple of years, and then they get resolved and there's nothing to worry about. And so I went into my first surveillance MRI a couple of weeks ago, not worried at all, not much on my mind. I had a little lump on my left side that I had identified, and it was still there when I got to my oncologist, and I wasn't worried about it. And it went away before the MRI even came. So by the time the MRI came around, it wasn't even there. There was no pain. There was no bump, as there had been before. So I just didn't expect the MRI to come back with something. But it did. And I happened to be at the big global breast cancer gathering of scientists and doctors down in San Antonio, where there was, I think, 500 of us patient advocates present. Lots and lots and lots of people learning about breast cancer, and the call came in. I was walking with a fellow advocate, one of my newer advocates on my team with the Lobular Breast Cancer Alliance. We were going into a big ballroom, lecture room, to learn about the latest in screening and imaging modalities. And I saw on my phone that there was a voicemail coming in from the hospital saying that the radiologist wanted me to go for an ultrasound. I didn't look at it right at first. I waited until I got home way later that night. Wasn't too anxious about it because of the context of that larger breast cancer community that I was standing physically within. It wasn't something that was alarming me, and I wasn't going to let it interrupt my learning that day. I actually already had an ultrasound set up, just coincidentally because of that lump that I had found a whole month prior. And so on Monday, right after I got home, I had an ultrasound at a beautiful private clinic wonderful radiologist that did my first set of biopsies. I love her. I trust her. And I knew she'd come back in after the ultrasound tech was done. I had about 20 minutes to sit on the table and wait and think about what I would say to her if she came back with a concern. And she came in just when I was done thinking and pondering. And she did seem to have some concern. I don't know how much concern there was. I didn't feel like she was pressing me to do something right away, but she did offer to do a biopsy right away. And I had already decided that if she offered to do a needle biopsy, that I would turn it down and talk to my oncologist first about the possibility of having an excisional biopsy or a surgical biopsy. Because I have had such a horrible time with biopsies in the past, raise your hand if you can relate, I didn't want to have a needle biopsy, and I didn't want to have one for a number of reasons. First of all, my trauma with biopsies. That first biopsy that I did with that radiologist wasn't so bad, but the second one, the stereotactic biopsy, was awful and just pretty nightmarish, actually. And then they left a clip in for my first biopsy. Didn't mind that at first, but the clip ended up building up a lot of scar tissue and was really painful. Felt like a marble of pain in my breast up until my mastectomy, and of course it was removed for my mastectomy, but I always vowed that I'd never have another little piece of titanium put in my body. Well, of course, if I had had a needle biopsy, they would put a piece of titanium in my lymph node to show where it was, and I didn't want that, and I wanted to talk to my oncologist about that. I feel so blessed that even though my oncologist was on vacation for 2 weeks, she has shared her email address with me, the one that she can check from home. And I knew that she would be checking it even though she was on vacation. That's how dedicated of a clinician she is. She's a researcher most of the time, but she does clinical hours 1 day a week. And I knew that she'd get right back to me, and she did. And she said, yeah, let's see what the surgeons will say about that. I think she probably knew that there was no surgeon that would agree to doing an excisional biopsy or surgical biopsy and skipping the needle biopsy. And I heard back from the surgeons that I contacted right away, and their staff said that they would recommend a needle biopsy. And then I actually got a hold of a surgeon down in San Francisco that I know has a lot of knowledge of lobular cancer. And one of my big worries with a biopsy is that I would miss lobular cells because they're so easy to miss. They tend to be strung out and not in a hard core that's central and easy to identify. And needle biopsies are usually done with ultrasound, and I didn't want to miss any lobular cells the way that they tend to get missed. But this lobular expert down in San Francisco, whose email address I also happen to have, and I feel so guilty because I feel so privileged to have access to these women, but most of it is because I'm also really active in the advocacy space, and so I'm connecting with them over other things as well. But she said also that I would need to have a titanium marker placed in that lymph node, even though it's right next to the surface. It could only be identified through ultrasound and marked with titanium, even if it was to be removed surgically. So that would be a first step that I would have to take anyway. And what I said to her was, well, I just want to know that it's going to be taken out. If it has a titanium clip in it, that's fine for a small period of time, but I want it to be taken out. And so, of course, I feel like I'm making this huge deal over something that could be absolutely nothing. It could just be an inflamed lymph node that goes away tomorrow and shrinks down to nothing tomorrow. There is a reason to take it very seriously. And of course, I've been on the phone and trying to set up now the 2 different biopsies, the surgical one with a surgeon and going back to the radiologist that I saw this Monday for my ultrasound for the needle biopsy and the placement of the titanium chip. I just wanted to share this with those of you who are wondering, are in this place of thinking that you may be having a recurrence, that you have some pain on your chest or in your underarm like I do, and you're wondering kind of how this goes and what the waiting time is like and how the feelings are hitting me during this period of time that I have to wait. Unfortunately, right through Christmas week and my birthday, which was yesterday. So lots of fun. I'm not too anxious yet. I really am looking at it as kind of a chance for discovery, a chance to learn about my body further. And because I've had all these little false scares that were nothing, I think I still have a lot of false confidence that it will be nothing. And I'm relying on that false confidence to carry me through to the first week of January when I get to see all of my professionals, get the biopsy, get the other biopsy hopefully, talk to my oncologist in person. That has to wait until after the holiday break. And so I'm floating on this kind of cushiony sea of false positivity and false confidence that I am very happy to take. So that's where I am emotionally. I think the hardest thing for me has been, just like when I got initially diagnosed with DCIS that was scary enough to have to excise, the hardest thing, of course, is knowing whether to share it with loved ones. I don't mind sharing it with you out there in YouTube land because you're not very close to me, but those people who are close to me will worry, and will worry maybe more than I'm worrying because they have less knowledge than I have and less confidence in my practitioners to do something about it if there is something bad happening inside me. So that's always the hardest thing when bad news comes up or potential bad news comes up. The hardest thing is, do I share it with my breast cancer friends and community? Do I share it with my loved ones, my close family members, and my close friends? And so, of course, I'm kind of an open book, as you may have noticed. And of course, it would be really hard for me at this time of year to be in touch with people and not telling them about it. I haven't had long, lengthy discussions about it with anyone. I haven't presented it in a worrying way to anyone, and that's been really good. I feel like I had a lot of practice at that when I first got diagnosed and before my first mastectomy, when I was planning my first mastectomy. And the need to not worry people is something that also weighs on me. Like the fact that I'm not impressing a lot of fear on others helps me not to be fearful. So it's a really good kind of approach to it, I think, that I feel good about. And just not talking about it excessively also helps. Although, of course, I'm thinking about it and learning about it excessively. And I decided I wanted for my birthday yesterday to spend the day watching the recordings that just got released from the annual, well, up until now it's been annual, ILC symposium, the lobular cancer gathering of scientists every year, which was recorded this September, and I was told that it wasn't going to be recorded. So seeing that the videos came out on YouTube just this week was really exciting to me. I love watching scientists talk about lobular breast cancer and DCIS, but it's easier, I think, for the lobular community because it's all kind of gathered in one small space. All the experts are all together every year because there's so few of them. So I've really been enjoying watching those videos, taking notes on them, learning little bits of new information that are coming out this year that maybe weren't shared last year. And that educational shoring up is really helpful for me mentally and emotionally right now. Of course, this could all just completely pass. My lymph node, like I said, could stop hurting, could stop feeling solid, could stop lighting up on all the machines at any moment and any day and any month. But it also could continue to be a concern, and until we get in there and see what's going on, I won't know whether it's one extreme or the other. Absolutely nothing. Or maybe something that causes me to have some kind of treatment, which I haven't had to have up until now. I'm still not through the menopause transition. I have not taken my mom's letrozole that she left behind when she died, that I keep right here on my desk for some crazy reason, and I've been tempted to take it, but I haven't finished transitioning into menopause yet, so I can't take it. It wouldn't be effective if I did. One thing I learned at San Antonio this year is that letrozole and other AIs, or aromatase inhibitors, actually do take effect rather quickly. Some studies were done to see if they made any difference after just a couple of weeks. The couple of weeks, or maybe 4 weeks, that people are waiting between the time that they set their surgery to have a mastectomy or lumpectomy and the time that they had it. There was a couple of studies that put people on AIs to see if it shrunk their tumors in between. And it did for some people, not everyone, but for some it did. So I know that whenever I am allowed to take an AI or letrozole or anastrozole or exemestane, it may start making a difference in my body. pretty quickly, which is really reassuring, because when my mom was prescribed this bottle of letrozole, she was told that it would take 6 weeks or 8 weeks to start working. So I have lots to think about. I am in this liminal space, and what I've decided to do is kind of the same thing I decided to do when I was in the liminal space of waiting for my mastectomy, which is to write as much as I can. I find that I'm really creative when I'm in a space of unknowing and waiting, and a space of a little bit of fear and anxiety. I do best when I write it out, when I express it in words. And I'm sure other people will do the same with verbal or audible words, speaking to others, loved ones, about their stress. For me, it's a silent writing kind of expression of words. And so I know that about myself, because I really poured out a lot of words during my up until and after mastectomy process. Between my 2 mastectomies was the most fruitful time I've ever had in my life at writing, and I feel really good about what I've written during that time. And so I'm treasuring this liminal space as a time to be creative and use that vulnerability that I'm feeling to make something beautiful on the page, which I think others will maybe someday be able to relate to. And of course, sharing here also is a way of expressing and being creative, but mostly because I want people to know what this feels like to be in this position that I'm sitting in right now. Having had an MRI that was positive, 1 lymph node lighting up, having had an ultrasound that was positive, 1 lymph node lighting up, not having had a biopsy yet, anticipating the biopsy, hating that anticipation, hating the idea that I have to have a biopsy, feeling powerless, working through that, expressing the positive things behind that. There are so many positive things. Seeing that I just came back from Texas and San Antonio and learned some amazing breakthroughs about DCIS, my main type of precancer, about metastatic cancer, which I was much more interested in this year than I was last year, because my mom had mets in the last few months, well, in the month after I got back from San Antonio last year. So I'm much more interested in learning about metastatic breast cancer now, because she went through that, and I relate so much to her, and I anticipate that I might go through that in a way that I didn't before she got it. But I learned in San Antonio the most beautiful realization and mind-blowing realization, just in passing, just kind of mentioned in passing on one of the lectures from a metastatic brain cancer or breast cancer brain mets scientist and researcher, who just mentioned very lightly that all of our metastatic occurrences, if we should have them, all started way back before we ever discovered our early breast cancer, even those of us who had early breast cancer. The mets already started and seeded themselves in our bodies before that. So crazy. I would have never guessed that was the case. I've always been in this kind of race to improve my lifestyle so that I don't get mets. Well, if I am to have mets, then I already had it before I ever knew that I had cancer, which maybe even was 10 years before I had my mastectomy, since I started getting diagnostic screenings every 6 months about 10 years before I had my mastectomies and got diagnosed with anything. So it could have been, if I am to have metastatic breast cancer, which who knows if I am, but if I am to have it, it was something that happened way, way back where I couldn't have changed that or controlled that even during the last couple of years. So I can relax, not put pressure on myself to pre-solve this problem or avoid this problem, that if it is to be true, it is going to be true no matter what I do. Just to have learned that is so freedom-giving and so amazing, and why I love being a lifelong learner and a breast cancer advocate that is interested in learning about the latest research. So lots to take comfort in, lots to focus on that is not negative, and it's nice that it's kind of a hibernating time of year, because I'm a hibernating kind of person. So I can kind of just sink back and watch the videos of the LBCA or the ILC symposium and be a bookworm and take notes and then write out what I'm feeling and the stories in my heart that maybe someday I'll be able to share with others too. So for me, that's what it feels like to have this possible recurrence situation. It's not so bad. And I hope that you can face it with lots of strength and positivity too, if it ever should happen to you. And if you're watching this video because you did a search about recurrence and you're going through recurrence, my heart is with you, and I hope that you'll feel that you're not alone through this video. And be sure and keep in touch with me through my ongoing work, which is mostly through my podcast, A Breast Cancer Diary. Right now, I'm not doing videos as often as I used to because I'm focusing on the podcast, telling stories of other women that have gone through breast cancer and metastatic breast cancer, which is a really big story that I want to tell, mainly to reduce the fear that goes on in those of us who are daily fearing recurrence and imagining recurrence in our lives. It's definitely been me up until now. And I hope that this isn't one, but if it is, I will be sharing every bit of it with you here too. So happy holidays if you're watching this at the time that it's being released. And if not, I'll be talking to you on my podcast, A Breast Cancer Diary, very soon. Season 2 is coming up in January. I'll talk to you then.